A real value of vacuum massage, which is a recently popular procedure and used massage therapists around the country. In this short video, we'll discuss pros and cons, how therapists can use vacuum massage to enhance patient or client health, or they can destroy patient and client health. That's the goal of this short video. My name is Dr. Turchaninov. I'm founder of Science of Massage Institute located in Phoenix, Arizona. Let me tell you a couple stories. I am working on my patient and one of our physicians knocks on the door and asks me to step into her room. And she said, I never saw anything like that. What you see on the picture is what she saw in her examination room. The patient who was sitting there, truck driver, was crying from the pain and dysfunction to the degree that he lost sensation through the entire left arm and he came here for help. What's happened to him? He had numbness on the thumb and he went to nationally certified vacuum massage specialist. And what you see is the consequence of absolutely ridiculous application when the grown man, tough grown man, crying like baby from incredible amount of pain and dysfunction. If you compare his right and left shoulder, you see that entire left shoulder swollen and the hematoma which you see in the skin. A blood actually accumulated between the skin and superficial fascia, lifting skin and create horrible peripheral edema through entire arm. He cannot feel his left arm now, not only thumb. And we were forced to keep him 2 weeks on steroids just for me to start touch him, because intensity of the pain and discomfort were so severe. As you can see here, the therapist not only damaged skin and superficial fascia, she created active bleeding between the tissue, and that dramatically affected quality of his life and his health. And it took me after steroid for 2-3 weeks to put everything together, and that took huge amount of toll on his health, on his family, on money what he lost, and all of that because mistake of one person. What you see right now on the screen is another picture. That's another patient who came to us with debilitating headache as a result of incorrect cupping when she had posterior cervical pain. And you can see where the cup was placed creates severe hematoma in her suboccipital space. And that was irritating her occipital nerves and create a right side horrible headache she didn't have before one session of cupping. So what I'll show you where to use it, how to use it, and where not to use it, because that is unfortunately very mispresented therapy, and our clinic deal on weekly basis with completely ridiculous result of the vacuum massage application. If you want to decisively help patients in complex clinical cases, greatly increase your income, and partner with local medical communities, please click right now at the link below in description and join us for live medical massage seminars and webinars, and we will work together. Thank you and see you in the future. So, in what cases therapists can use vacuum massage? You can address skin itself, that's one application, to decrease tension within the skin and address so-called cutaneous reflex zones. Another scenario, therapists can affect superficial fascia by decompressing that using vacuum massage. Finally, it can be used in the cases of chronic visceral disorder, for example, pulmonary disorder. And in each scenario, application is different. So I will show you application of each scenario, and then you will know when and how to use it. In all other scenarios, there is other modalities which much more efficient. You cannot rely on one modality therapists learn and apply it from patient to patient. Every modality has its own niche of application. And what we will discuss today, niches of application for the vacuum massage in clinical cases. When there is no pain, no dysfunction, therapists can do whatever they want if a client agree on that. When you deal with the patient with pathological abnormality, niche of application is very small, and when you understand importance of that and how to use it, then you can improve patient health. In all other scenarios, it will create opposite negative impact on the health of the tissue and patient. First of all, what to use. This is the best treatment option for vacuum massage. Don't use plastic or glass. It is very aggressive to the tissue. Therapists need to be in love with client or patient soft tissue. So what advantage of silicone jars? They're flexible and the edge is not damaging tissue, producing excessive hematomas. Secondarily, the application of the vacuum comes from the simple thing as applying pressure on top of the jar. And another important component of that, it has shape when you can control jar and it's moving through the patient body. First of all, on the skin, if the therapist create a lot of vacuum and the tissue will be sucked into the jar, that's what creates unnecessary excessive hematoma. To address the skin, therapists need to put a lot of lubricant on the skin, then apply jar, apply pressure on top of it, and then create vacuum inside the jar. And while you using shape of the jar, you can move it along the skin to addressing area where the patient has numbness, tingling, burning sensation, sign of sensory deficit. That's only what needed to address skin. And what I'm doing right now, I am addressing skin across of dermatomes, which are innervate patient skin. So in such scenario, that is only application. If I create more vacuum, while I will do that, I will actually tear the fibers and create leakage and hematoma. So another scenario, which will be now application of the vacuum massage for the decompression of superficial fascia. From that perspective, you applying again vacuum, create vacuum inside, and now you need to lift the tissue and going that back and forth, as you can see here in this application, but I'm slightly lifting the cup, and the vacuum need to be very gradual, because if you apply a lot of vacuum, you will again damage and tear the tissue. The vacuum only enough, if I apply a little bit more pressure, it detaches itself. That prevents excessive leakage. So when I'm using vacuum massage on the patient, while I'm lifting the tissue, I'm lifting the skin, and by lifting the skin, you separate skin from the fascia, and skin and fascia hold together by fibrotic bridges. And tension with fibrotic bridges actually restrict mobility of the fascia. When you lift the skin and the cup moves with the skin along and across the segment, you stretching fibrotic bridges which hold skin and subcutaneous tissue against more stable fascia. If you create too much vacuum, that the bleeding starts between the skin and the fascia, and that creates excessive hematoma and then form adhesions within the soft tissue, restricting mobility. So instead of increasing mobility between the layers, therapist actually on the long run decreases mobility by creating excessive bleeding, and that is unfortunately a very frequent consequence of incorrect vacuum massage application. Again, here is my vacuum, and here is application along the skin. And here is my vacuum for the fascia, where I create more pressure and now lift the jar and move jar in the mobile regime along the or across the segment, elevating skin and stretching fibrotic bridges to separate skin from superficial fascia. Third application, let's say that patient suffer from the pneumonia. In such case, you applying smaller cup, smaller than this, and the set has different cups, and then you create more vacuum, and that you keep it in the steady position. So you need to apply cupping in the steady position, not just where you would like to apply that, but you apply it according to the reflex zones distribution. Those reflex zones, those part of the soft tissue which share same innervation with affected lungs. That is critical factor. From that perspective, application of the stationary vacuum need to be done in specific places, which can be associated and found in the so-called ductal head zones or ductal Glaser and Deliha zones. We show these zones right now on the screen when you can see where the cups need to be placed in cases of pulmonary disorders. But the same charts available for different abnormalities, intestinal disorders, cardiac disorders. Each of them have their own distribution and placement of the cup for reflex mechanism of vacuum massage when a local hematoma which created in the tissue actually start to alter function of the affected inner organ through the common reflex neurological pathways, holding soft tissue and inner organ together because they're always talking with each other through the reflexes which connect different parts of the human body. I would like clearly to deliver a message. This is 3 applications of vacuum massage in clinical setting. And there is no any other clinically proven applications. Rest of that, personal opinions. We cannot put patient health and his well-being in the mercy of personal opinions. There is supposed to be clinical and statistical data which supports that. From that point of view, I would like you to use vacuum massage not as independent treatment session, but as a part of the treatment session when other modality used equally important point of view. So from that, the vacuum massage efficient in 3 clinical cases. When you need to stimulate the skin according to the map of dermatomes which you see right now on your screen, then you can decompress superficial fascia according to the laser Deliha zones or according to somatic abnormality what you found in the form of the facial restrictions. And finally, you can use stationary application as a reflex mechanism to enhance recovery of the chronic visceral disorders. That is 3 major niches of application of vacuum massage in the clinical setting. And the rest of that need to be addressed with other modalities. So what do you think about this video? And if you would like to leave comment, please leave them below and we can have intellectual discussion to exchange ideas and experiences. And let's work together to bring your massage practice in the medical massage field and enhance clinical application. Thank you for watching.